Hello, I'm Gary Jones. I'm one of the volunteers here at the hospital. I've been a volunteer here for about 7 years. I joined at a time when we were known as Pink Ladies, but as you can see, I didn't quite fit that description. I volunteer in a couple different areas. Most recently, I've been working at the entrances, both east and west, and also I'm on the COVID call-in line, so if you're dialing for a COVID appointment, you might be talking to me. The story of why I became a volunteer is a little bit complicated. 15 years ago, I was working as a volunteer fireman. I had a cardiac arrest. I was flatlined. I was given CPR by paramedics all the way into the hospital. The hospital got their emergency team together and put in stents. I think having the pressure of having firemen over the backs of the hospital workers gave them a little bit extra motivation to get the work done. But ever since that day, I've had a new appreciation for life. I've had a much greater appreciation for the role that medical people take. And I made a pledge that when I retired, I would try to give back to the medical community. So that was one of the primary reasons I was ready for it. Secondly, I like to serve my fellow man, so to speak. And a lot of people, when they come into the hospital, feel very nervous. They feel a little upset. And if there's anything I can do to alleviate that. And the third reason is very personal. I'm probably going to spend a little bit of time in the hospital in the future, and I want to know what's going on. I want to know who the nurses are. I want to know who the doctors are. I don't want to be afraid or nervous. So I feel very good about volunteering. I work as a volunteer. We work about 4-hour shifts. Sometimes I work 3 or 4 times a month. Sometimes I work up to 10 or 12. But I really enjoy working here.